Hello, Dr. Brandt Gibson, and today I want to talk to you about another type of nerve malfunction called complex regional pain syndrome. Now, complex regional pain syndrome is a malfunction of the nerve that becomes chronic, usually over about 6 months, and it usually affects a single extremity, so a single arm, a single hand, a single foot, single leg, and can be pretty debilitating because of the severe pain. There are two types of complex regional pain syndrome. Type 1 and type 2. Type 1 was previously called reflex sympathetic dystrophy, and it means that you have a nerve malfunction without known nerve injury. And the second type, complex regional pain syndrome 2, which was previously called causalgia, is the similar symptoms with a known nerve injury. So in both cases, you're getting this similar symptoms. So what are some of the common symptoms that you're going to see? You're going to see changes in skin texture to the affected area. You're going to see abnormal sweating patterns. You're going to see changes in the nail and hair growth patterns, stiffness in the affected joints in the area, problem coordinating muscle movement and abnormal movement in the affected limb. And like we said, significant pain. The skin can even get sometimes blotchy, blue, purple, pale, or red. And it can be sometimes even shiny. There are x-ray diagnostic factors as well, but truthfully, it's really symptomatic. There's not good ways to diagnose this other than to rule out some of the other possible causes. And so we do testing to rule out arthritis, Lyme disease, generalized muscle disease. A lot of times you may be going, okay, I'm going to rule out some of the small fiber polyneuropathies to get me to this type of neuropathy that's called complex regional pain syndrome. So complex regional pain syndrome is a pretty problematic and debilitating problem that can affect individuals. It's usually caused by some form of trauma, whether it's surgery or injury, that the body reacts incorrectly to, and the nerve starts to fail to function like it's supposed to or malfunction. And it can be pretty problematic as far as what it does for you. So what are the treatment options? The most important thing is rehab and physical therapy. The idea with a complex regional pain syndrome problem, we want to be very aggressive at getting the motion, getting everything moving, helping the muscles. It seems to reduce the symptoms and shorten the problems if you actually can get it moving. Psychotherapy is sometimes utilized because the mind is very, very powerful. And then there are medications. Any of the medications that are used for chronic pain can be used, including corticosteroids, non-steroidal anti-inflammatories, opioids like oxycodone, morphine, hydrocodone. But there are some other medications like local anesthetic or patches that can be used, such as even the lidocaine patch. There are bisphosphonates, that have been shown to do. They've also shown even botulism toxin injections to the area to interfere with the functioning of the nerves in that area. So the point is, you're treating symptoms is really what you're doing. And most of the time, we don't have to get to the more severe type treatments like spinal cord stimulators or sympathectomies surgically, or sympathetic nerve blocks, basically saying, okay, we want to cut these out. Most of the time, those are not necessary. And most of the time, we can actually really treat these by being aggressive at the physical therapy, aggressive at some of these other treatments. So complex regional pain syndrome can be really problematic. It is a form of peripheral neuropathy. It's a small group that I usually like to consider separate because there seems to be some central nervous system portions of complex regional pain syndrome as well. And so it can't be only treated as a peripheral neuropathy. And the symptoms are quite distinct and pretty problematic. So it's important that you get that diagnosis and determine, yes, this is complex regional pain syndrome, not a typical peripheral neuropathy. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 52.